World Health Organization say despite the unprecedented worldwide efforts to shut down much of life as we know it, it's not enough unless we ramp up testing. Here at home, the big question, do we even have enough tests? President Trump is urging Americans not to gather in groups larger than 10 people. This as the markets continue their free fall. The Dow down nearly 3,000 points, the second worst day in its 124-year history. Overseas, the situation in Europe is growing more grim. In Italy, the death toll continues to rise. Spain and France now on lockdown too. The French president declaring we are at war. But in the midst of this somber news, a glimmer of hope. The first human vaccine trials have begun. Good evening, everyone, and thanks so much for streaming with us. I'm Lindsay Davis. We begin with the story on everyone's minds, of course, the spread of the coronavirus. It is an unprecedented time. Earlier today, President Trump addressed the nation from the White House, urging Americans to make critical changes and sacrifices right now to combat the spread of the virus. The president's new recommendations now include avoid gatherings of more than 10 people. All students should be homeschooled if possible. Workers should do their jobs from home if possible. The elderly should stay indoors, and everyone should avoid eating in public places like restaurants, bars, and food courts. And tonight, here in New York City, one of the culinary capitals of the world, all restaurants are either closed or restricted to takeout and delivery. The nation's largest school district was also closed today. More than 1 million New York City children now staying home until at least the end of April. Drive-through testing centers are being set up around the country as demand skyrockets. And in Washington state, the first human trial for a coronavirus vaccine is now underway. 45 healthy men and women, the ages of 18 to 55, will take part in phase 1. We'll also take a look overseas at the kind of crisis that we might be facing in the weeks ahead. But we begin here at home with our Whit Johnson as America shuts down.
Tonight, with daily life grinding to a halt across America, the White House announcing drastic steps, part of a 15-day plan to slow the spread.
We'd much rather be ahead of the curve than behind it.
President Trump's coronavirus task force now urging people to avoid gatherings of 10 or more people, discretionary travel, encouraging older people and those with underlying conditions to stay home. The administration also telling people not to visit nursing homes and recommending bars and restaurants close in states with community spread.
If everyone makes this change or these critical changes and sacrifices now, we will rally together as one nation and we will defeat the virus.
You're not saying it's under control, right?
I'm not referring to it, meaning the... Yeah, if you're talking about the virus, no, that's not under control for any place in the world.
The president now warning the crisis could stretch deep into the summer.
People are talking about July, August, something like that. So it could be right in that period of time where I say it washes through. Other people don't like that term, but where it washes through.
But today, a major step toward a possible vaccine.
The trial is taking place in Seattle. There will be 2 injections, one at 0 day, first one, then 28 days. There will be 3 separate doses.
Volunteer Jennifer Haller getting the first injection in Seattle as part of that clinical trial.
Everybody's feeling so helpless right now, and I realized that there was something that I could do to help.
The vaccine's still not expected to be available to the public for at least a year. Tonight, with the cases across the country climbing, more than a dozen states already closing bars and restaurants except for takeout and delivery, including New York, Connecticut, and New Jersey, who will also shut down gyms, movie theaters, and casinos starting tonight.
This is a national problem. It cannot be done in a piecemeal method.
In the San Francisco Bay Area, a sweeping shelter-in-place order for nearly 7 million people. Residents told to only leave their homes for food, medicine, and exercise. California's governor is urging home isolation for all adults over the age of 65.
Most important thing, again, is to protect the most vulnerable.
Nationwide, at least 35 states closing public schools, forcing more than 35 million kids to stay home.
Creates a lot of hardship for people, but it's the right choice.
In Boston, volunteers boxing up homework to deliver to students at home. And with so many American children without access to school meals, communities from Pennsylvania to Texas stepping up to make sure families have the supplies they need.
Trying to stay positive in a bad situation, so that's it.
Long lines at Costco's from Illinois to Los Angeles.
And thousands of people are rushing to trying to get into the Costco here in this
lines snaking around the building before dawn. Stores across the country running out of basic items like toilet paper and water. The Stop and Shop grocery chain announcing new early shopping hours for customers 60 and over. At U.S. airports, chaos as Americans rush home after travel bans on European countries. Passengers waiting hours, shoulder to shoulder for medical screenings.
I definitely felt unsafe. If the government's telling me to stay in groups of less than 50 and keep social distancing, that was the opposite.
But departures areas around the country eerily empty.
But look at this. There's just nobody here at the airport.
And Whit Johnson joins us now from New York. The president was asked today if he's considering a nationwide lockdown or quarantine. Is that at all a possibility?
Yeah, Lindsay, the president faced a lot of questions about this today, but he made clear, at least at this point, that they are not looking at the possibility of a nationwide quarantine. He did, however, say that they are evaluating certain hot spots. Those are hard-hit areas across the country to see if any additional restrictions could be required.
And here in New York, all public schools are closed until at least April 20th. And now across the country, nearly 36 million students are out of school. Is there concern that this could possibly last for the rest of the school year?
Absolutely, Lindsay. In fact, Mayor de Blasio said himself that it is possible this could go through the school year, and that raises a lot of questions about what will happen in the summertime. As you mentioned there, as of now, schools set to stay closed through April 20th. That's through the current spring break. But teachers and students and parents are all trying to get up to speed here. Remember, this is the largest school district in the country, more than 1 million students. Kids are out of school today, but they don't think they're going to have their remote learning capabilities up and running until next Monday. So what will happen over the course of the next week? Teachers are trying to send out homework to parents. Also, you have thousands of students who depend on meals every single day. So right now they are opening up some schools and trying to find other ways to deliver breakfast and lunch to students in need.
Yeah,
Lindsay?
certainly critical that the kids get the food and sustenance that they need. Whit Johnson, thank you so much for that. And we turn now to growing concerns about the strain on America's healthcare system as COVID-19 cases mount. In North Carolina, this lab is working to create tests to detect coronavirus as access to testing continues to be an issue. But many are now pointing to the challenges faced by doctors and hospital workers, those who are on the front line. Some have been infected with the virus. Healthcare workers could be putting their lives at risk because of shortages of protective equipment. Hospitals are bracing now for potential overflow, setting up tents outside of emergency rooms. Our Matt Gutman has more on hospitals at the brink.
Tonight, America's hospitals and healthcare workers under siege. Emergency room Dr. James Pruden testing positive for coronavirus. The 70-year-old is now in isolation in Paterson, New Jersey. And tonight, at the Life Care Center in King County, Washington, 46 employees testing positive. In another nursing home in the same town where 15 people have died, a doctor in his 40s is infected. Over 43 people have died in King County alone. Hospitals around the country now reporting both a spike in incoming patients and a shortage of critical protective equipment, also crucial to protecting themselves. Hospitals scrambling to prepare for the onslaught, setting up tents outside emergency rooms. New York Governor Andrew Cuomo calling on President Trump to mobilize the military to build more hospitals.
You overwhelm the hospitals. You have people on gurneys in hallways. That is what is going to happen now if we do nothing.
Another critical matter, testing. People lining up in cars for drive-thrus. Vice President Pence repeatedly saying more tests will be available.
By the weekend, another 1 million tests will be shipped around the country. The expectation that at the end of next week, 4 million tests will be shipped.
But it's not as simple as just sending out the tests. The healthcare workers need to be in full protective gear. A number of states now saying they're concerned about a shortage of protective gear to keep clinicians safe.
This is something we are very concerned about.
Testing numbers are also lagging. New York has conducted roughly 7,000 since the outbreak. Public labs in North Carolina, however, have only done about 300. And in South Korea, where the number of cases have flattened, 275,000 tests have been conducted. They're now even creating phone booth-type sites. Donovan Mitchell is an NBA player with the Utah Jazz. He's in isolation after becoming infected, and his case highlighting the need for more testing.
I don't have any symptoms. That's the scariest part about this virus is that, you may seem fine, be fine, and you never know who you may be talking to, who they're going home to.
Even those who do get tested are having problems. Amanda Fulmachan says her husband Titu's first test got lost, and they then had to complain to their governor before getting a second test, which was positive.
We still don't have the original test results that were sent out from Thursday, which is absolutely mind-boggling to me. These tests have got to be prioritized based on severity and acuity of these cases. Something is very, very wrong. I understand that everyone's learning as they go with this, but people that are in critical condition need those test results, quickly. They don't have time to wait.
He's now in a Virginia ICU in critical condition.
People now frustrated and with good reason. Matt Gutman joins us now live. Matt, we're seeing tents outside of emergency rooms. What other measures are available if hospitals do become overrun?
There are a number of measures that are being used, but primarily clinicians across the country are trying to protect healthcare workers and first responders. That's why you see tents like this. This is not for overflow. This is for triage. So anybody who comes in showing symptoms of fever, anything that looks like a flu, they're going to get checked here and then tested to see if they have COVID-19. Now, one of the big concerns is that these new tests are being rolled out. There are going to be many thousands of them across the country, but that personal protective gear that clinicians need to wear in order to protect themselves when they administer these tests and these swabs, they're running out of those. So finally, we're going to be at a point where there actually are enough tests for most people who need them, but not enough PPE, protection equipment, for the clinicians who need to administer the test. So that is a major concern going on right now, Lindsay.
Of course it is. And how does the federal government plan to help out these hospitals?
There is a national stockpile, essentially, of personal protective equipment, other medicines that might be tapped at some point. They are talking about when that goes out, who needs it most, and it'll have to be delivered over a period of time. But I think that is now already in the works. Lindsay.
Such a precarious predicament we find ourselves in. Matt Gutman, thank you so much for that. To the White House now, and a sobering message tonight from President Trump. At today's briefing, the president saying that people are very scared and it may take until July or August for the virus to fully pass through the nation. Our senior White House correspondent Cecilia Vega has the story from the White House.
Despite widespread delays over testing and repeated mixed messages from his own administration, today President Trump gave himself high marks.
And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it a 10. I think we've done a great job.
Does the buck stop with you?
Yeah, normally, but I think when you hear this has never been done before in this country.
But the confusing messages from the administration continued. The New York Times reporting that President Trump stunned some of the nation's governors in a conference call, telling them they should not wait for the federal government's help with respirators, ventilators, and other critical life-saving equipment, telling them they should, quote, try getting it yourselves. Asked about that today, the president did not back down.
If they can get them directly, it's always going to be faster if they can get them directly if they need them. And I've given them authorization to order directly.
President Trump had said the virus would just disappear. Now he's marking a shift in tone.
How are you talking to your own family about this? How are you talking to your youngest son? Do you empathize with this sense of anxiety? People are really scared.
Yeah, no, I think they are very scared. What you can do and all you can do is professional, totally competent. But I think that what we do, and I've spoken actually with my son, he says, how bad is this? It's bad. It's bad.
The president himself was exposed to the coronavirus a little over a week ago. The Brazilian official in this photograph tested positive. The president was tested himself on Friday. He says the test came back negative.
Not something I want to do every day, I can tell you that.
And Cecilia Vega joins us now from the White House. Cecilia, you talked about that change in tone from the president, and you also said that you noticed procedures that the White House started taking today for journalists.
Yeah, Lindsay, and not just journalists, frankly, anybody who comes onto the White House grounds. There's a gate that you have to walk through past security to get here. Obviously, you go through a lot of security, but before you even get to that gate, now there are two people standing outside with thermometers, basically taking everyone's temperature before they're allowed to enter into the White House grounds. And if you've got any kind kind of high temperature, you're not allowed to come in. We saw one journalist over the weekend turned away. It's not just the temperature taking, well, I should also tell you, as I was even walking down the street that you see here behind me, I had my temperature taken twice in just a matter of feet before I was allowed to enter that briefing with the president today. But then inside that briefing, you could tell by looking at all those journalists who were sitting in there. Normally the quarters are really packed. We're basically sitting on top of each other. Now we're practicing those new social distancing rules with an empty seat between all of us in there. So certainly a new world and a new normal here at this White House, Lindsay.
Yeah, new normal all around. Cecilia Vega, thank you so much. And joining me now for more on what Congress is doing right now to help combat this pandemic is Arizona Republican Senator Martha McSally. Thanks so much for taking the time to talk with us, Senator.
Absolutely, Lindsay. Thanks for having me on.
Many Americans want help now. Do you expect that the Senate will get to the bill by the end of the night, and do you plan to vote for it?
Well, we need to act swiftly. There were some technical problems with the first version of the bill, so they need to fix those. We've been hearing from small businesses when I've been back in Arizona saying, look, they want to help. They want to be able to support their employees, staying home if they're sick. But we also need to make sure that they don't get crushed under this. And there's mechanisms to get funds directly to them to pay for that family leave. So we're working with the Treasury as quickly as possible to make sure those resources are available. And our hearts go out, first of all, to everybody who is being impacted by this virus and those whose families are impacted. So this is a time for us to be unified, Republicans and Democrats, but let's make sure that we're able to get resources quickly out to those families, individuals, and those small businesses that are going to be able to support these people to stay home if they're feeling sick and help our country to get through this.
Right, and talking about those small businesses, what's your plan to make sure a waitress in Phoenix who may be out of work indefinitely can make her rent? Or what about a firefighter in Tucson that still has a job but now needs daycare for their kids?
Yes. So I've been meeting people like this all the time. Today, on the way to the airport, I met the woman who owns a shoe shine business, and she just had one person, and she's concerned about paying her rent. You know, I've talked to people like this all the time. I think we need additional resources quickly. This second piece of legislation first was the emergency supplemental. Now this is focused on supporting people to allow their employees to stay home, but there needs to be more so that individuals who are impacted, as we see this economic impact, are able to pay their rent, pay their groceries. And look, this is time for all of us to come together. This is a whole of society issue. We need a strong federal response, but we also, the faith-based community in our communities, you know, I've reached out to my neighbors who are elderly saying, please stay home. What do you need? I'll go to the store for you. What else can we do to maybe babysit for nurses who need to be caring for patients, but they don't have daycare anymore? You have to be, you know, healthy for you to do this. Don't have grandma and grandpa because they're the ones who are vulnerable. But I think there's ways that we as a society can also address this with compassion and lack of, and selflessness, while we here in D.C. are trying to get those funds out there to keep businesses afloat and keep families afloat.
Now, in an interview on Fox News 5 days ago, you said, and I'd like to quote, "We are the best prepared of anyone when talking about the government's ability to handle the spread of the coronavirus." Yeah. A lot has happened since then, certainly, yes, but many hospitals still don't have the tests that they need. Should more tests have been made available much sooner?
Yeah, absolutely they should. We're seeing this frustration in Arizona. And let me say, we are the best as a country. We're not going to have a totalitarian response like China did to address it. So there comes with challenges of a free society. That's why this message of stay home if you can. Those of us who are young and healthy, we're going to be fine. But it's not about us. It's about protecting the greatest generation and flattening that curve. And so we together with our scientists, our doctors, government, private sector, all of us together have to get through this. It's going to be difficult, but we'll come out the other side. And so we've got to have that hope while we take this message very seriously of what we can each do to keep the seniors and the vulnerable safe.
Now, today, President Trump asked governors to try to get masks, ventilators, and respirators on their own. Do you think that the federal government should be doing more to help out the states? And should it nationalize the production of these critical items so that states can get what they need?
Well, we've been pushing on this across the board. I've been working with Governor Ducey. I think he and his team are doing a great job to push and break through some of the log jams and the bureaucracies at the federal level. And it includes equipment for sure, PPE equipment, respirators. We all need to do this, as a federal government, all across the board to make sure that our healthcare workers have everything they need to care for the sick and vulnerable, and that we flatten that curve so they're not overwhelmed with those sick and vulnerable.
Your colleague Mitt Romney proposed a $1,000 a month income for all American adults during this pandemic, which could help a lot of Americans who may soon or are currently out of work. Is that something that you're ready to support?
I think we need to do something like that very quickly. I don't think rich people need another $1,000. So think about mechanisms where we're not setting up a new bureaucracy. This has been done before. Just get some resources to those who need it so they can stay afloat. So I look forward to working with Senator Romney and others. Let's move something quickly. The next single-digit days, I think, really matters for my constituents, small businesses and families, for them to be able to get through this next phase. And as quickly as we can pass resources out to support them, we'll get on the other side of this. We will. But right now is a critical couple of weeks for us.
Arizona heads to the polls tomorrow. Should voters be showing up in person tomorrow, or should the election in Arizona be delayed?
I'll leave that to Governor Ducey. I will say that a lot of people do vote by mail in Arizona. I'm not sure what the percentage is for this primary, but the governor has that decision to make. I'd ask everybody just to be safe. Keep your distance from people. Wash your hands. If you're sick, stay home. I mean, all those things that are going to keep us safe are so important, whether you're voting or having to go to the grocery store. But as much as people can stay home, that's what's going to help us as a society to protect the vulnerable.
Senator McSally, thank you so much for your time. Brutal day on Wall Street. The Dow sank nearly 3,000 points, its worst day since 1987, and its second biggest single-day percentage loss in history. This, of course, comes amid growing fears over the coronavirus outbreak. Even the president, who's been reluctant to recognize the economic impact of coronavirus, said this afternoon the economy, quote, may be heading into recession. So to help us make sense of all of this, let's bring in Rebecca Jarvis, who's down on Wall Street. Rebecca, we keep seeing these huge drops in the market. What do people need to know about what happened today?
Well, I think what people should know is that this is all part of our new reality. And just as Americans are watching this reality thinking, what does it all mean? So is Wall Street. And they're coming to terms with the fact that there's a lot of math here, a lot of hits to the economy. And as they start to actually take into account how dramatic the impact, even if it's a near-term impact, will be on companies, that's what's driving this volatility, Lindsay.
And now let's move past the numbers for a moment and focus on the real-world impact that this is going to hit businesses, especially small businesses, really hard, and could lead to a lot of layoffs.
Well, and that's the concern here, and in particular, those small businesses. There are 30 million small businesses in America, and a lot of them are the restaurants, the cafes, the bars, which are being closed right now, put into lockdown for the foreseeable future. Those are the places that are going to need access to money in the near term so that they can keep those employees on. And if those employees are out because of the fact that their companies are shut down for the time being, they're the ones who are going to need that fiscal stimulus, the paid sick leave more than almost anyone else in America. In particular, the people who work for companies that have told them to stay home and not to come in if they're sick. A lot of those companies, the tech companies, for example, have those benefits already in the system. But for people who work for small businesses, in many cases, that's not true.
And let's talk about the airlines for a moment, because they in particular seem to be in trouble today. A trade group for the industry called for a $50 billion bailout. But you've done some reporting that shows that they weren't really prepared for any disaster, let alone one this big.
Well, what they had been doing with their money prior to this is buying back their own stock. And frankly, it's something that most of corporate America has been doing for most of last year and even in the years before then. When corporate America saw that interest rates were low, they took advantage of that. They actually borrowed money, took on new debt in order to buy back their stock. And what that meant when we watched the stock market grow and climb was that we saw the stock market continuing to grow, but these companies, and many of them are in the airline industry and other industries, took on all of this debt. Now, I will say there are 750,000 Americans that currently work for airline companies. So even though you have this financial aspect on one side, you have the very real near-term immediate needs of those individuals. And so this warning today, Lindsay, from the airline industry suggesting that it was a likely scenario that they would be out of money by the end of this year without a $50 billion bailout. That is something that we also have to take seriously, in spite of the fact that they weren't prepared for this, just like a lot of companies and industries were not prepared for this at all and spent their money on buying back their stock.
Right. Just hard to believe, though, that the airline industry could be out of money by the end of the year. Rebecca Jarvis, thank you so much. And when we come back, the death toll continues to mount in Europe as